It's
like
nice.
Yeah. Oh no. Yeah. I like, I'm a weighted blanket kind of girl, so it works for me.
Right on. Absolutely. I'm going to start recording, and we will begin as people start to trickle in. So.
This meeting is being recorded.
All right. It is 4:00. Welcome to the Easthampton Mayor's COVID-19 virtual town hall. Mayor LaChapelle, please take it away.
Thank you, Ryan, and thank you to Easthampton Media for making these town halls possible. Today we have a guest, our health agent. She's kind of a frequent flyer on our town hall. Bree Eichenstadt. Am I getting better on pronouncing that last name, maybe?
Close.
You are,
I think
are just too kind. Too kind. I'll phonetically write it out.
Yeah.
So we have, there's been a lot of activity on the state level, as well as the local level in our efforts to push back the infection and spread of COVID-19. We've seen it across the country. I think it's very easy to look at those numbers going up and feeling like it's not us and it's fine. Where that's quite the opposite. All of the good work and health orders in place now have allowed us to flatten that curve that was much higher, but also keeps that curve of infection and spread down. So our work is not done, and we're seeing some troubling upticks. Which led to some new orders on the state and then affected our local orders. I've asked Bree to come on today to walk through those changes and what we can expect from the city to communicate what's happening next in our fight against COVID-19, and also answer any questions from the public around the topic. So Bree, if you could walk through the newest health orders and what you're seeing around the city.
Sure. Yeah. So I think that's a good point about, we're nowhere near the end for COVID. There's a short amount of time in July that I thought we were doing, things were kind of on the rise or things were getting better, but it just can change so quickly, which kind of brings me to my next point about the interactive map. Just looked at it. It was released yesterday, an updated one, and we are in the yellow area.
Yeah,
where
I saw that.
We're the only community in Western Mass, unless Athol is in Western Mass, besides Holyoke and Springfield, who are yellow. So that was kind of concerning to me. Our almost all of Western Mass is white, and then there's a lot of green, and then there's just us three that are yellow, and South Hadley is red, which it just again shows how quickly things can change. They were not red last week. So we want to stay on top of what we've already been doing and continue doing everything that we can to continue to lower our numbers, hopefully back
Bree,
down
can I
to
just
a white
interrupt
area.
with a clarifying question on that? So when we're looking at different cities and we're looking at Easthampton, that was green and now it's yellow, that interactive map, is that updated weekly on Wednesday at 4:00, or is that daily? Like, how often is that updated? Do we know?
I thought it was every 2 weeks. It may be every week, but I don't think it's daily. I did think it was daily at one point, but I do know that we just changed as of yesterday. So I don't think it's updated daily. So yeah, I think it's going to be similar to how the state releases the numbers every Wednesday.
Yep, that makes sense.
I think they'll update the map at the same time. Yeah, so yellow means 4 to 8 cases per 100,000. Daily, it's an average daily case count over a 2-week period. So it's about, I think we're kind of teetering around 4.5 cases a day.
Okay.
So the Board of Health voted first the state recently in the past couple of weeks went down from 100 people outside for gatherings and then 50 indoors down to 50 and 25. So 50 is the cap outside and 25 is indoor. So we kind of saw the state roll back some more limitations based on our numbers statewide going up. So the Board of Health did put into effect effective tomorrow, 8 a.m. They voted on it last night for a mask order for certain areas around town where masks
Okay.
would be masks would be required regardless of social distancing, on the bike path and city-owned parks and property, and then the orange highlighted area on the map, which I can show you. I don't know how good of a job it's going to look on here, but it's like the business area and the mill area. So Cottage
Okay.
Street, Union Street, a small part of Main Street, down Pleasant Street, and kind of in between. And the reasoning for that was we were seeing some crowding happening outside of businesses, people waiting for food, people waiting for a
Mhm.
table, crowding with no masks on. And we really don't want to get lax on wearing masks, and we want to continue
Yep.
doing everything that we can. So, um, additionally, outside of those areas listed, masks are required to be on your person, on any public sidewalk. So if you're outside of that area and you're walking, your dog by yourself, you at least have to have a mask on you,
Mhm.
to put on if needed. There's been some questions about enforcement.
Yep.
Easthampton Police and any agent of the Board of Health, so myself and our new health inspector, Alex, um, are able to enforce this order. But I think it's really important to note that we are not going to be going out on the streets with our ticket book in hand and ticketing every single person we see. That's never been our approach to things, and it hasn't
Yep.
been Easthampton Police's approach to things. So the ticketing is a tool if there's an absolute egregious offense over and over and over again, but it's really going to be a lot about education, verbal warnings. We have plenty of
Yeah.
masks to give out. So if we see, two people not wearing a mask within one of the areas required, we'll give them a mask and we'll try to give them, the opportunity to comply. So I just want the public to rest assured that we are not going out with our ticket books and writing all these
Mhm.
tickets.
Yeah.
And the other thing to note is that the police department and staff in my department are really going to use discretion and common sense.
Yeah.
If we see somebody, way down the way in a park, they're not near anyone, we're not going to run
Yeah.
over there and ticket them, so we're going to use some common sense here as well.
Mhm.
So, and there are a
Great.
couple exemptions. One of them is if you're eating outside at a restaurant, as the state allows, or if you are stationary and eating or drinking. So there are some questions, what if I go get ice cream? If you could just be stationary, eat the ice cream, or if you go somewhere to get a drink or something.
Mhm.
So those are kind of the points. Oh, and then we will be putting up some pretty highly visible signage around town,
Yeah.
with very simple language. And then there will be a QR code that people can scan if they have more questions. Like, so what does a mandatory mask zone mean? They can scan the QR code and it will bring them to an
Mhm.
informational sheet that will explain it further.
Great. I have a couple of clarifying questions.
Mhm.
So, all right. So with the indoor limits now at 25 and outdoor at 50, are there precautions, spacing that go along with that lowering of indoor and outdoor gatherings?
Yeah, so there's a indoor outdoor gathering checklist that the state has created. It's the requirements that they put into a checklist. It is on our website. We do have a new link on our website that brings you to just a COVID page with all of the information.
Yeah.
So yes, distancing is still required. There's some, frequent hand washing, hand sanitizer.
Mhm.
And another note about the gatherings is a lot of people will go straight to, oh, the max is 50, so I can have 50 people here. You first have to base it off of square footage, which it's 8 people per 1,000 square feet.
Okay.
If you have all the square footage in the world, then yes, you cap it at 50. But if you only have, 2,000 square feet, then you're technically
Mhm.
supposed to cap it at 16. Even though the max is 50, that doesn't mean you can just jump to the max. So there's been some confusion about that as well.
Yep.
So.
Okay. So right. So it's not just okay. You can get 25 people in a room. There's very specific qualifications on that.
Yeah, indoor, it's actually off of your occupancy limit that's set forth by the building department. If
Mhm.
there's not an occupancy limit, then you go to the square footage, which is 8 per 1,000.
Okay.
Outdoors, it's just 8 per 1,000 because there's typically no occupancy limit in an outdoor area.
Great. So the other is, so as far as sitting down and eating at an outdoor table and you can take your mask off, um, there I've gotten a couple of questions about sidewalk tables where you're sitting at the table, your mask is off, like just like it's allowed, but people are walking by the sidewalk, like they're on the sidewalk, not engaging with the people at the table. You know, what's the rule? Should people who are sitting at that table put their masks on as people walk by?
I would think that it's more on the responsibility of the people walking by, because those that are sitting at the table are technically, having a
Mhm.
dining experience at that
Yeah.
restaurant. So, that would be my take on it.
Yep.
Um,
Great.
so
And then, okay, so we also, we get a lot of calls around work sites, construction work sites, and who is wearing a mask and who is not, and police details and whatnot. Can you clarify, like, I know we have a health safety plan for our big construction sites, and then there's an attestation for the smaller ones. But when people are driving by or like on the bike path and they see folks not wearing masks on these jobs, are there exemptions, or what's the rule of thumb there?
yeah, so if on a job site, if you've got one person doing siding and one person's on the other side doing roofing,
Yep.
totally 6 feet apart, they don't need masks. But if you've got two guys in a trench and they're face to face and they're digging, they should have masks on. Our police officers have masks um, available, and a lot of the times, like I know coming into work this morning on Holyoke Street, I think the officers were hundreds of feet away. So
Right.
if they're not near anyone, they technically don't need a mask. But if they're, side by side, if they're on a call, that type of stuff, they always put their masks on. So, yeah, we did put up some signs around town. They're orange about job sites because there was some
Yeah.
confusion, and there was, some issues with construction sites. Some people not wearing masks. We got some complaints, so we just wanted to remind kind of both sides that they need to be within 6 feet, but also to the actual workers to make sure that they're wearing them.
Great. Seen a lot in the news about the gaiters that go up versus masks versus face shields. So when we're going into a mandatory, mask zone, and I think that's what the signs say, right? Mandatory mask zone. So how does that work with? I guess I have two questions. How does that work with gaiters and face masks? And then what I've been reading about the gaiters in particular, that they're not as effective as we thought.
Okay. I do know that the state has written into their mask orders that they need to be able to cover the nose and the mouth kind of fully.
Yeah.
The problem with face shield, I know you're mentioning gaiters, but the problem with face shield is they don't cover your mouth entirely. They kind of just stop out here. So
Right.
we have been told by epidemiologists at the state level on our conference calls that face shields, the plastic ones that you see, cannot be used in lieu of a face mask.
Okay.
Some people that have medical exemptions, if they're comfortable wearing a face shield, that's fine. They don't have to, obviously, if they have an exemption, but you can't wear a face shield instead of a mask. You can wear them both, but I've not seen anything out there about the gaiters. They do cover the nose and the mouth. So my experience is they've been allowed.
And what I've read about the gaiters is that they're too thin. Like if you can see, like they're that thinner material, so it's easier to breathe through. I've seen a lot of folks who are exercising and younger kids, and they're wearing them, and it's the what I've learned or what I've read is that the masks usually it's a thicker material, and or there's like 2 layers of material. So I mean, that's why I bring it up, or I ask if there, you've seen anything about that.
Yeah, I've not seen anything in particular about the gators themselves. But I do know that the face shield, they're not recommended
Yeah. Okay.
in lieu of the mask.
Very good. And then, related but not related to COVID-19, the health department has seen some shifts and building up staffing. And if you could just walk us through what positions are coming on and what they'll be doing, I think that would be very helpful.
Yes, I wanted to mention that we, our new health inspector, Alex White, started on Monday, which it couldn't have been better timing because August we saw the most number of COVID complaints total.
Yeah.
And so it's great. He has experience inspecting. He was an inspector at UMass, so he's able to just get right into it.
Yeah.
A lot of
Yeah.
restaurants might have already met him this week.
Yeah.
So
Yeah.
he's awesome and he really enjoys it. And I mean, we kind of threw him to the wolves after Monday. I gave him like a little overview and then Tuesday he was he was on his own. So we are so very grateful to have him. It's just extremely helpful because also with the new mask order,
Yeah.
I do anticipate getting more complaints and more emails and so it will be good to have him. And he'll also spend some time, doing the education and compliance with the handing out masks in the areas. And then our nursing our regional nursing program that we signed on to with Northampton back a couple of months ago, we paid for through GPH grant money. And that contract is coming up to an end at the end of August. So we have signed on with Northampton to continue the contact tracing with them. So they do all of our contact tracing for the city of Easthampton. So moving forward, we will have them.
But do we still have a nursing, like we were hoping to do a more holistic contract with Northampton for nursing services? Are we still looking for a nurse on top of the hours we have?
So we have a 5-hour-a-week nurse right now that's doing the communicable disease tracking in Maven that's not related to COVID. But yeah, I think moving forward, we'll want to start looking into having more extensive nursing programs and capacity, especially now that the state has required immunizations for all students, I think before December. So we're going to want to look into flu clinics and being able to assist the public with hopefully getting those vaccinations out.
Another question is, so if I walk into a restaurant and I can see like the kitchen and the food prep line and somebody's prepping like an order to go and they don't have a face mask on, but they're not near anyone, because they're preparing food, do they have to have the face mask on? Or is that like a construction site where if they're far enough away from people, they don't?
So both state and local Board of Health orders do require masks to be on all employees. And that is the state restaurant requirements do state that. So yes, they do need to have the mask on. There hasn't been a ton of evidence of COVID transmitting through food. However, it is a requirement so they do need to wear those. Okay. And they have to wear them up over their nose. We get a lot of calls about places wearing them right under their nose. So just a reminder that they should be up over the nose and the mouth. And I get that it gets hot, so taking breaks. And I think one restaurant even got creative and found these, like, I don't know if they're gaiters or masks, but you can actually put them in water and freeze them so they stay cold. So I thought that was a really good idea. Yeah,
that's a great idea. Yeah, especially working in her. And then so as far as those COVID complaints, and the governor talked a little bit about this, where enforcement falls on the local Board of Health and anybody who is sworn in as a health agent. But then there are a way to file directly with the Department of Labor Services on the state level those local complaints, and just how does that work between, like, that we're not doubling efforts, or is there a difference between the state level complaint form with DLS and what you get in your department?
Yeah, so the Department of Labor standards was brought on early on with COVID, um, to assist local boards of health with interpreting the regulations that the governor has, continuously been putting out.
Yeah.
So they are on both our Tuesday and Friday conference calls, and they are there to help interpret the codes, but they also recently have been offering, people can file complaints straight with them, but
Okay.
most likely they're going to contact me first and say, hey, what's going on here? And
Yeah.
they may push it back to us depending.
Yeah.
However, there are some cases that we may get several complaints about, or we're having
Yeah.
trouble doing enforcement, and they can take those on completely. So that's an option for us as well. So
Understood.
if someone,
Understood.
yeah, if someone has a concern, I think at the local level, they can start with us. And if
Yeah.
we feel as if we can't handle it, or, then we
Yeah.
can forward it off the DLS.
Great. And how do you file a local complaint?
So complaints can be sent to either myself, Alex, or the general health email. So the general health email is health@easthamptonma.gov. And then both Alex and I have personal emails. And then in regards to the mask order,
Yeah.
there's a special email just for those types of complaints, which is COVID complaints
Okay.
at easthamptonma.gov. And you can send any complaints to that one, we'll get it. But
Right.
we wanted to make sure that all mask complaints in regards to the order were going to one central location instead of going
Understood.
to the parks department, the police department, mayor's
Right.
office, health department. So we will be logging all of those and, keeping an eye on it if there's any hot spots, like, oh, we're having a ton of issues over here. So
Right. And how to deal with that.
yeah.
So Bree, is there you mentioned quickly flu clinics. I know that's pretty new public health mandate there. Is it and I know I emailed you earlier today about, is it possible for us to do a flu clinic, like a drive-through flu clinic, kind of like the way we did the mask giveaway, or what do you see coming from that order, and how we can address it as a city?
Yeah, I'm curious to see if the state's going to offer any resources to us.
Yeah.
Similar to how they've created those stop the spread sites, which they did actually just open one in Holyoke, which is available until I think September 12th, or it might be September 19th. They haven't released the address as of now, but keep an eye on the website for the location in Holyoke. We have a conference call every Tuesday and Friday. So tomorrow I am expecting them to release some information. But if not, we would definitely look into maybe partnering with a pharmacy or a local hospital or doctor's office to do something. Because I'm assuming the state's going to have some type of plan, because I'm assuming everyone's kind of wondering, well, how are we going to mass vaccinate every single child that needs to go to school? So I would say stay tuned for that.
Okay, great. Anything else you want to add about your department, or something I overlooked, or you want to share in general?
No, just we still have masks available. So if anybody has needs a mask, we can get those. But we are super busy. We're seeing everyone's complaints. We follow up on every single complaint. We try to respond to everyone personally. With the mask complaints in regards to the order, I don't know if we'll be able to respond personally to every single one.
Yeah.
But general complaints, if you need to put any type of complaints in, we're inspecting lots of food trucks and getting those up and running. A list of all permitted food trucks are always on our website. So if you are a brewery or a beer garden that needs a food truck, you can always check our website. And that's it. We're just busy, but
great.
Yeah.
You're very busy. Extremely busy. And it's good to hear that Alex is on board. And I know you and Jackie have been working a lot. not to mention doing, the regular work of a health department. Does anyone in the public have any questions for Bree, or COVID related questions?
Peter's got his hand up. I will unmute you. Oh, I muted you because you unmuted yourself.
Okay.
Good. You're good.
Good. Hi. Bree, I'm wondering how you came up with the zone and the area for the mask-free zone. I mean, have you been able to identify that this is the main transmission point in Easthampton? Because I'm failing to understand the areas, like why you picked those. Like, for example, if I ride my bicycle through the city, that is more dangerous, like, than sitting in a restaurant having dinner with friends.
Sure. So the area, a couple different reasons. So the bike path, we received a lot of complaints about people not wearing masks. A lot of people were concerned because when passing others on the bike path, there's not 6 feet of distancing. So based on complaint, the number of complaints we got about the bike path, and then for the business area and the mill area, that's where we see the most congregating throughout the city. So the Nashwanik Pond kind of boardwalk, outside of the restaurants on the business district. Our Board of Health members have seen, I don't live in town, so I'm not always here on the weekends, but on the weekends when we're experiencing busy times and moments, there's a lot of crowding outside of restaurants waiting for tables. And it seems like the public is getting a little bit lax on the mask wearing. So that's why those specific areas were chosen. It seems to be where where most people tend to congregate.
Right. To your point with the bike path, did the CDC guidelines change? Because I thought me passing by you without 6 feet max distance doesn't make a difference. Like that, typically when they do contact tracing, it's like at least 10-minute contact point. So if you say that, hey, I'm riding by with like 20 miles an hour with a bicycle by people, that in those 1 second or 2 seconds, my risk is so enhanced. I'm just trying to understand this. I mean, I'm all for like safety. I just feel like we're going maybe a little bit overboard.
Mm-hmm. Yeah, so the CDC, so when it comes down to contact tracing, you're correct. Because I know that kind of came up when there was a positive case at a local business. There was some concern about, do I need to quarantine? So the CDC definition of close contact is within 6 feet for 10 minutes or more. But we just have been seeing a lot of congregating on the bike path. The bike path's fairly busy, depends on the day, but I frequent the bike path often. And the Board of Health felt that, we've got to do everything that we can. And hopefully if it, prevents one case, then that's a win, I guess. But I understand, I do understand, there's some confusion in the public about it, but the Board of Health just really wants to be as safe as possible at this time. There's a similar order in Northampton that also requires masks on the bike path and in the downtown area. So
I just feel as a citizen or like a resident of Easthampton, it becomes tricky if every mayor and every Board of Health just like interprets the rules differently, and they all feel like, well, because if going by your rule, what you should all be doing is like have a stay-at-home order by the mayor and not go out. Because then we save more lives than with a mask order, or we should do the whole city as a mask-free zone. So I hear you. It just, again, I feel it's frustrating that every town you have to like almost like take a rule book with you, like, what can I do in Southampton? What can I do in Northampton today?
Right.
yeah, that is tricky. I wish that the state would just, but in Massachusetts, and I'm not sure, there's like 3 other states in the country that do it this way, where there's a Board of Health in every single, so we have 351 boards of health. And on our conference calls, there's a lot of boards of health that plead with the state and say the exact same thing that you're saying, that it's confusing because neighboring towns will enforce things differently than, so, we could be following the state requirements, but say Northampton's not, it creates a lot of confusion. So I feel I have, that frustration at times too, but, the Board of Health is just tasked with Easthampton, so they're trying to do their best for the city.
And I appreciate it. I know it's a, strange time, let's call it that. I appreciate it.
Yeah, thank you.
Yes. Yeah, you're right. I think at this point, Peter, we're just beyond any like 3 or 4 words to describe just where we all are. And strange covers a lot. So, but any more questions for Bree? So Bree, let me just clarify. So on our website, easthamptonma.gov, there you can click on it. There's a blue button that kind of gets you to COVID information, but then also at the health department, you have the local orders as well as links to state information.
Yeah, so if you go to the health department site, there's a big link at the top. You can't miss it that says COVID info. I post current events anytime something happens. So like when the travel order happened or when this happened.
Yeah.
And my health department page itself got so long, and I thought that I don't like clutter. And like poor food truck owners were like, where's, how do I find the application? Yeah. So we made a separate site, and it's kind of broken. I've got the current events all at the bottom, and then it's broken down into sections. So there's all the current Board of Health orders, and then there's popular links and some helpful links, because there's a lot of information on the mass.gov site. So I just wanted to kind of make it
it's overwhelming.
Quick, just to be able to have a quick resource. So
great. Thank you so much, Bree. I have a couple of just overall update kind of housekeeping things. One, with our meetings and that are now all remote, if you go to easthamptonma.gov, on the left, you'll see agenda and minutes. You click and there's a listing by date, and you can sort for a specific meeting. We have added a column there, so you'll see the name of the board, the date and time, a block to download agenda and minutes, and then there's another column, and it's the exact Zoom link to the meeting for that day and time for that committee. Lots of confusion and inconsistencies on posted agendas. So we wanted to make it very easy for people to hop on those meetings and participate or just follow along. So we have a couple of boards that we still need to get links figured out, but you'll see more and more of those links. They're listed right there, right across the row from the meeting that they'll be covering. Also, we put up tents at 50 Payson Avenue, and just the strength of the tent wasn't strong enough with winds. So we returned those tents and have ordered a professional grade of tents for 50 Payson Avenue. The purpose for those tents are to set up small meetings with department heads and members of the public, as well community events like the farmers market use those tents to do some setup and registration and health precautions to access the farmers market. Also, department heads have set up and will set up again like hours of just that they're in the tent. So if people want to stop by and don't know exactly when during a given hour or 2 hour time span they're doing it, they can, and you'll find the assessor or myself or somebody from the clerk's office to answer questions and get paperwork out. So we hope to have the new higher grade tents up by the end of next week, not this week, next week. And if there is, a community interest in a board or committee that wants to do a very small meeting, of an executive board or event planning, you can contact my office at mayor@easthamptonma.gov to schedule it. We're scheduling them like their conference rooms, or give my office a call at 413-529-1470, and Lindsay or Zoe can help you set up some time for that meeting space, either for yourself and a city employee or some board business. If it's just easier to see each other in person. The tents are big. Their capacity, we're talking meetings not more than 4 people, but there are just some things that it's it just is easier to do in person. We will adjust that if we have concerns about health metrics. And would also, just in closing, really remind people that our data and our infection rate and the spread rate of COVID-19 in the city, it does vary. What is good one day can dip to a very dangerous level. And that, like the state does, there is kind of a look at averages over 7 and 15 day intervals to understand where we are as far as infection rate. So I mentioned that. That said, is there any more information that I can provide, or people have questions?
Not seeing it.
Great. Thank you for those who are with us right now, and also thanks to folks who are watching. Bree, thank you very much for all the work that you do and continue to do, and taking a little time to be here with me today. We'll be posting the next town hall and the guest on our website, also on Facebook page. So tune in. They're Thursday at 4 p.m. If there's something that you want to see for town hall, a guest or content, please get a hold of me at mayor@easthamptonma.gov, or give us a call, 413-529-1470, and we can work together to make it happen. Ryan, thank you and the Easthampton media team for being with us and making this all possible, as well as all your technical assistance for our mobile remote city government.
Thank you. I just want to remind everybody, as always, that this meeting, as well as all of the previous virtual town halls, are available to view on Easthampton Media's YouTube channel and are being broadcast over the channel.
Thank you so much. Everyone, please stay home as much as you can. Cover your nose, cover your mouth, wash your hands a lot. Be well.
Thanks.
Thank you.
The